Welcome back to Health Matters. During the first part of the show, I spoke with holistic dentist Ken Walsh, and I proposed to you this following poll question. Here it is one more time for you. Have you noticed that the mercury in your mouth from amalgam teeth fillings is making you sick? Let us know, rogerstv.com/healthmatters. And now I'd like to dive into a different field of health called neuropsychology. Every day people engage in activities that can put them at risk for sustaining a head injury, and a concussion is one of the most common forms of head injuries. With me now are doctors Diana Velakanja and her colleague Jane Story. Welcome, ladies.
Hello.
Hi, thanks for being here. So my question is for, first of all, Dr. Diana Velakanja. How are you? So you are a licensed neuropsychologist. You practice at Hamilton Health Sciences. You've held the appointment of Chief of Psychology there for several years. You're also a professor there. I can go on and on about your accolades. Clearly, I'm speaking to the best expert. What is neuropsychology for people out there?
So neuropsychology is the study of basically how all aspects of the brain process information. So from what we see, what we hear, what we smell, basically how the brain processes, identifies the information, processes it, how we attend to it, remember it, how we use it to solve problems or think about things, create ideas, how we inhibit our behavioral processes. So it's sort of interested in all aspects of information processing in the brain, including emotion as well. So typically in psychology, the general interest is more so in how the brain processes our emotions, our reactions, and perceptions of the environment, and also how we respond to emotional things around us. So,
okay. Nice. And Dr. Jane, so you have a PhD in psychology
and clinical neuropsychology.
Okay, and a C-Psych degree. So you're, or is it?
It's a registered. That's our
so you're both. You're dual.
It's well, we get a PhD in psychology, and then when we get registered with the college, we get to use the C-Psych designation.
Nice. And you're president-elect of the Ontario Psychological Association.
Yes.
Congratulations.
Thank you.
Okay. Can you explain to viewers, please, what the difference and similarities are between a neuropsychologist and other types of psychology?
Well, I think people are probably more familiar with a psychologist. So when you go to see a psychologist, usually you're having some issues with emotional situations, dealing with feelings and perhaps thoughts. And a neuropsychologist can look at those things as well, but they are also interested in cognitive abilities. So functions that the brain is responsible for. So thinking, concentration, attention. Those kinds of things.
Okay, so ladies, you brought some brains with you.
not real brain.
So take us through the brain and how brain functions relates to psychological processes and behaviors.
So this is part of my little historical lesson. So neuropsychology is a relatively new area, but people started to look at brain and behavior relationships back in ancient Greece. And there was a really, really big push in the early 1800s. And at that time, phrenology was born, the practice of phrenology. And in this practice, there was it was thought that various parts of the brain represented different aspects of our character. Okay. So people would actually feel the top of your head and they would look for bumps. The idea is that if you had a strength in that particular character, that part of your character, it would correspond to a bump in your head. So
have you felt your own head?
Yeah. You know what's interesting about this, though,
is this still used today?
Some people do practice phrenology today. Obviously it's been largely debunked, and certainly we don't practice this as part of neuropsychology. But what always interests me is they got some things right.
Like
so
what?
some of these brain areas actually do correspond to what actually goes on in the brain, and this was a practice that developed before there was neuroimaging.
Okay, like, can you give me an example?
Well, they have some of the ideas about moral behavior, moral thought, what the kind of aspects that make you human. That comes from sort of the frontal lobe. There's some right hemisphere parts of the brain involved in that, and the phrenologist actually said that. So that's interesting.
It is interesting. Dr. Diana, can you take us through the brain and maybe talk about the different lobes and how they function?
Okay. This is a little tricky to manipulate, and my nails aren't as lovely as hers. So there's generally 4 major lobes of the brain. So there's the frontal lobes, the parietal lobes here, and the occipital lobes in the back, and the temporal lobes along the side here. And the occipital lobes process primarily the information from the visual system. So we see things with our eyes, and that information immediately goes to the back of the brain. And then this area starts to process the information. And as it moves forward into these parietal areas, that adds sort of that visual spatial dimension. So we start to get color identification, figuring out how large, small, and so on. The temporal lobes are typically known for the perception of auditory information, so our ability to perceive pitch and sound and so on, and as well as they play a major role in memory, so our ability to remember new information in particular. And then the front part of the brain is sort of our area. When we're born, this is the smallest part of typically our brain. Most of the posterior part of the brain is not fully developed, but more developed than the front of the brain, because the frontal lobes of the brain tend to develop more with experience. Okay. So this is sort of not our seat of intelligence, if you will. It's our ability, it's our creative skills, it's our problem-solving abilities. It's the things we learn over our lifetime through experience. So these, by the time we're adults, become the largest area of the brain. So then on the inside, then you start to see some of the deeper structures in the brain. So where emotion is generated is deeper in the brain, and then those connections come up to the front part of the brain where a lot of those signals are modulated, and we sort of get our temperament and our ability to sort of the way that we tend to express our emotions. This is sort of an area for balance and so on. So those are just some of the major areas of functioning and what our brain does.
Thank you for sharing that. Let's get into brain injuries. According to the Brain Injury Association of Canada, no two brain injuries are alike. Ladies, what are the signs of a concussion or a brain injury?
Well, I think that we probably have to first figure out if a concussion is a brain injury. And so for examining concussions is, it's not something that is new, although the interest in it, there's certainly more research being conducted now than ever before. And so we have been taught so far that a concussion is the same as a mild traumatic brain injury, so that they were sort of one and the same thing. About every 4 years, there's an international consensus statement that's released, and they just released the most recent one. And in that one, they want to sort of look at concussion as being separate and distinct from the mild traumatic brain injury. And I think that we're looking now more at brain injury as being on a continuum. Okay. So concussion has functional changes, so that when you are concussed, there's differences in impairment in how you're functioning, but there's probably not structural damage to the brain itself. And when you move up towards brain injury, you're starting to see some structural changes.
Got it. Okay, so signs of a brain injury.
Sorry. So
just get back to that.
So with concussion, there are a number of different symptoms, and so there's physical symptoms where people will complain of a headache. There's nausea and vomiting. They could have a sore neck, depending on how they sustained the concussion in the first place. There is cognitive problems, so again, difficulties in attention or short-term memory. There is changes in behavior, so the person may become more irritable than normal. They may have insomnia. So there's a really large constellation of symptoms, and you don't need to have all of them to meet diagnostic criteria. One thing I think that's important to note is you don't have to lose consciousness to have sustained a concussion. So you can be awake through the entire thing.
And how often does it go undiagnosed then?
It goes undiagnosed a lot, actually, because I think people have the idea that if you've just had your bell rung but you haven't lost consciousness, it's probably nothing to worry about. I think the other thing that we have to clear up is you don't have to hit your head to have a concussion. So if you are hit anywhere on the body and it causes a reaction in the head, so that the mechanics of the injury moves towards the head, you can have a concussion.
Do you want to talk about the acceleration-deceleration process then, maybe in the car accident?
Yeah, so your brain sort of has a consistency that's relatively soft,
Yeah.
and it's floating in cerebrospinal fluid, which is kind of like the consistency of water, a little thicker. And then our brains, so that sort of that matter, and encased in that is, it's all encased in a skull, which is of course very, very hard. So there's movement or room between where the skull is and where the brain matter is. So basically, and our brain is able to take small jolting within the skull. So the kinds of things when we bump into certain things at times, you know, it can kind of do that soft cushiony blow. But when the forces are much greater than what the brain is able to cushion, then you get in acceleration, deceleration, the front part of the brain sort of slamming into the skull, and then it sloshes all the way back and then slams into the occipital, and this parietal area then slams back into the posterior part of the skull. And the brain's layered in different regions, four layers, 6 layers in different regions, and there's all kinds of sort of what you call highway systems that connect the different cells together. So when it's sloshing back and forth, all these different layers are moving at different velocities too. So with things like concussion, a lot of what really can get affected are these highway systems that transmit the signals from one part of the brain to another. So that's when we start to see some of the impairments like Jane was talking about. So the information in our brain can't move properly, so therefore we can't attend to things for very long. So the things we kind of need that mental energy for, the ability to quickly integrate new information. So that's why people experience some of these immediate difficulties like that.
Given the acceleration, deceleration, what do you think of roller coasters for kids? Did you put your child on a roller coaster?
I'm going to bubble wrap my child. I don't know.
That's true. She will.
Wait, seriously though, it's a good question.
Well, certainly, and that's why I think some of the roller coasters, the gravitational forces are limited for certain ages. So that's why there's, they do have to be careful with that.
Yeah.
That's why things such as bungee jumping can be problematic for, the small capillaries and so on in the brain, because they can't take that level of gravitational force. So sometimes
Not to mention your vertebrae.
Yeah. But, so you can get these little bleeds in the brain from that, because the brain can't, those capillaries can't take that much gravitational force from the snapping back up. So there's some concerns about how.
So you need to
Absolutely.
ask Diana if she'll let her child play hockey.
We'll ask her that. After the break, we'll ask Diana if she'll let her child play hockey. Stay tuned on Health Matters, more with neuropsychologists. Welcome back to Health Matters. We're exploring neuropsychology and head traumas such as concussions. Okay, ladies, so I want to talk about Phineas Gage, unparalleled case in the history of psychology. The year was 1848. He was 25 years old in Vermont working on the railroads. The guy was packing explosives with an iron rod 8 inches long, and as he was packing it, a spark went off. The rod went right through his scalp, landed 10 meters away, smeared with brains and blood. Remarkably, this man walked away. 20 years later, well, throughout that time span, his doctor documented or cited mental manifestations of the head injury, the big hole in his head. A lot of damage was done to his frontal lobe and his parietal lobe. So he went from being a nice guy who could work to not being able to get a job. He became full of would be aggressive, vulgarities, impatient, So can you speak to the mental manifestations of a head injury and how it changes a person's personality, Diana?
And I think one of the interesting things about Phineas Gage was that there wasn't any impairment in intellectual ability. So even with that very dramatic injury that you're talking about, he was actually intellectually quite intact from the way that they had evaluated at that time. He was still very bright, still very creative, still had a lot of, good cognitive
Never
abilities.
lost consciousness, was wide awake
Awake
all the way
the
to the
whole
doctor's
time, yeah.
office.
It was an amazing
It was
case.
actually
Yeah.
a 4-foot-long metal tamping iron.
That went through. But what it really has highlighted is one of the major areas that it severed in the brain was was believed to be the connections from, and I touched a bit on this earlier, which was the areas of the brain, deep in the brain, with generate emotion. So those can be quite strong signals from the area of the brain in the orbital frontal region that regulates or modulates that emotion. And the other processes in the front of the brain that help to regulate our inhibitory processes, our ability to not say something when we know we shouldn't. Things
Right.
like that.
Yeah.
So he lost all these, modulation, emotional and behavioral modulation skills, and so that's why he became, he could do a job, but he didn't have any of the social skills to regulate his behavior. So if somebody would say something, he'd immediately react to it.
There's no censorship.
No
And that's
censor-
something that I wanted to ask you because, I worked with you like 14 years ago at Hamilton Health Sciences Corporation. I was a junior behavior therapist in the ABI department. And one of the things I noticed was when people were coming in, survivors of ABI, and they had, huge personality changes, like spewing out vulgarities and profanities, and they weren't aware that they were doing that. So my question to you would be, what happens to their self-awareness, to their mindfulness, to their sense of self?
And that's part of, so when we look at some of the emotional consequences, it's that ability to regulate, modulate, and there's areas of the brain, in particularly in the right side, which help to regulate our awareness of self. So our ability, if you think about really young children, they're not really aware of what their impact is on other individuals. Again, this is one of the things that our frontal lobe evolves over time, is our ability to understand how what we do affects other people. So it's the consequence, it's the insight, it's the ability to understand how we react impacts somebody else. And that's something we learn through experience and over time. When those areas of the brain are damaged, then people lose their ability to understand, again, the impact of their behavior on others. So they're just focused on how they feel in the moment. So how what you did or what you said or what happened in the situation affected them, but not how their reaction will impact somebody else. So that ability to see how you impact somebody else, and your insight and awareness into how your behavior can be quite affected.
Interesting. Concussions are huge in the area of sports, so I'm just going to shift into that field for a minute. I want to talk about female athletes. University of Minnesota produced a documentary called The Untold Story of Female Athletes and Concussion Injuries, and the reason they did this is because most of the data was on male athletes. So from their documentary, they found that female athletes were at a greater risk for a concussion playing hockey than male athletes were both in high school and college. So would you let your child play hockey? And two, you ladies do something called impact testing, right, for athletes. So do you want to talk about, maybe answer that question?
I'll talk a little bit about and one of the interesting things that just happened over the weekend is that Hockey Canada has banned contact in the Pee Wee leagues.
Oh.
So this
Body checking.
the body checking. So basically, this is quite a controversial issue. So because brain injuries in kids and adolescents can tend to have more significant consequences, because damaging a developing brain tends to have more problematic long-term consequences than damaging an already mature brain. So there's, in the sports literature now, there's a lot more caution given towards young kids. And so the controversy is, okay, we're protecting these young kids' brains, but then, some people are also saying, okay, well, if they never learn to protect themselves, check, or are they at higher risk later on when they get into the more competitive leagues, and that's what's going on? Are these kids going to, be at higher risk for injury later on? But the idea about why they've banned that at that league is because of this issue of injuring of developing brain.
Before you get into impact testing, the Neurological Health Charities Canada says that the effects of a concussion can be observed as mental and physical decline more than 30 years later. So do you think that the seriousness of a concussion is downplayed as short-term dizziness or confusion?
I think if you're just considering it short-term dizziness and confusion, you are downplaying the significance of concussion. With respect to what happens decades down the line, the jury's kind of still out on that. So that's some of the things that people might be hearing in the media about CTE, so chronic traumatic encephalopathy. And you might be aware of the former NFL players who are developing dementia-type symptoms, as well as some agitation and irritability and some difficulty with balance and gait. There's some concern that repeated hits to the head is resulting in this really big issue for these folks much later on. But there really hasn't been enough data collected long enough to show that there is a definite causal relationship between concussion on its own and the development of CTE, because what we need to do is sort of factor out normal aging, the effects of alcohol and drugs, and some other issues that might result in that. So impact testing?
Impact testing.
Impact testing. Impact testing is a computerized neurocognitive test that was developed in the mid-1990s. It is one of the, it's considered probably the gold standard in looking at a variety of skills and functions. It looks at things like verbal and visual memory and reaction time and processing speed. What's nice about impact testing is we can test kids who are going to be playing sports. We can test them at the beginning of the season, and that gives us a baseline. And so if they're concussed during the season, we can then bring them back in, test them again, and what we can see is how many problems they're having. So is it indeed...
That's great data for the parents.
It really, really is. Yeah. We do impact testing in our clinic, and so the kids that come to our clinic are getting the exact same testing that's done in the NFL and the NHL.
Nice.
So we keep baselines on file, and what we do with that is we can test people throughout their recovery. So not only can we tell, how much difficulties they're having in terms of their function, we can track their progress in recovery as well.
So what should a person do if they're suffering from a concussion? I mean, what's the first step?
Well, the first step is, it really depends on how severe the symptoms are. So there's some really important things to watch for. If there's been a loss of consciousness, if the person's very hard to wake up, they need to go to the hospital. They need to get checked out at the ER. Sometimes people go see their family doc if they've got sort of ongoing symptoms. We expect about 80% of concussions to just go away on their own, probably within 7 to 10 days. There's things that people can do, and that's rest. So normally people, if they've concussed in hockey, they know not to play hockey until they feel better. But what we've learned is that cognitive stress and activation can also impact how well you do after a concussion. So when people are recommended to rest, it's complete physical and cognitive rest. No video games.
No nothing, huh?
No nothing.
That leads me to the next question. Okay, according to the BIAC, it's important to recognize that more therapy does not make a person better, but that appropriate therapy does. So what is appropriate therapy, and what does treatment look like on your end?
Well, you have to look at how the injury was incurred too. So if there's mechanical forces like Jane was talking about, so to the body, to the neck and so on, you have to evaluate whether, because if that has happened, you definitely want people to go to physiotherapy and to get the kind of therapy to help deal with the neck injury that they need to, right? Because those can also produce symptoms that are concussion-like. So you have to really sort of think about and evaluate with the person what have been the forces involved in that and what could be the other areas of the body. So you need to have that medical piece and perspective and the physical treatment, because that's quite important. Then in terms of contact, you want to minimize any potential risk of re-injury. This is probably the cornerstone piece, right? The whole reason for being very conservative and pulling people out if there's any suspected concussion and keeping people out until they're asymptomatic is that if people are injured, again, while they're still symptomatic, that's when they can damage their brain much more severely and end up with a more severe brain injury than a mild concussion
So,
or an original.
Because it's so individual, so everyone's
Sure.
different. So we have to do almost a triage.
Yeah.
We bring the person in, we do a lot of assessments. It could be computerized, it could be neuropsych measures that we use. We're trying to get a sense of what that concussion is all about. And then what we do is we can develop treatment and management plans. So when we're looking at rest, we don't want people resting until they're completely without symptoms. What we want them to do is rest initially. and then,
Ladies, we have 1 minute left, sorry to cut you
Okay.
off, but what are some last minute tips or advice do you have maybe for parents in terms of helping their child protect their brains?
Helmets?
But let's be clear that a helmet will not protect your child against concussion. It will help protect your child against
yes.
a head injury.
Skull
So you won't
fracture.
fracture your skull perhaps, but you will still concuss. I think the big thing is take it seriously, mom and dad.
Yeah. If you suspect at all that there's doesn't seem to be something right with your child after they've been hit, it's better to pull them out and be much more cautious than take the risk that you've missed something and they could get injured again.
Nice, and they can always come see you. You ladies have been in practice for how long?
20, close to 20 years.
Say,
A
hey,
while.
For a while. Hey, you know what? Thanks so much for stopping by the studio. Please come back again, and we'll talk more about neuropsychology. As a final note, I will leave you with a few lines by children's poet Jack Prelutsky, who said, "Ashes to ashes, dust to dust, oil those brains before they rust." Have a fabulous evening.